Hey everyone, how's everyone doing today? This is HEADCHECK Health Talks podcast. I'm Eric Vanderhelm, the podcast host, and today we have Kaleigh, Pennock, and Braeden McKenzie here today. So why don't we just get started off by getting Kaleigh and Braeden to introduce themselves quickly, and then we'll jump into the questions about their research study on risk, responsibility, and prevention and injury management, the implications of concussion, miseducation on youth athlete knowledge uptake.
Perfect. Thank you, Eric. Happy to be here. So I'm Dr. Kaleigh Pennock. I'm an assistant professor in the Department of Recreation and Leisure Studies in the Faculty of Health at the University of Waterloo. And I'm the director of the Risk, Injury, Safety, and Equity, or RISE, Youth Sport Lab here at the university, where our focus is on critically examining the youth sport experience, including concussions and concussion management.
Awesome. Thanks, Kaleigh.
Thanks so much for having us, Eric. My name's Braeden McKenzie. I'm a postdoctoral fellow working in the RISE Youth Sport Lab with Kaleigh. And I also work as a postdoctoral fellow in the School of Exercise Science, Physical and Health Education at the University of Victoria. So I postdoc across a couple different institutions, but my research focuses on risk and responsibility. And a lot of my graduate work involved sort of concussion research. And so that's some of the work we'll chat about today.
Awesome. So it looks like this article that we're going to be referring today, or the article of the study, was published on February 17th, 2025. So one of the things we try to do here on the podcast is just, for people that don't want to maybe have read the entire study, but they want to gain some more information about it, or maybe they don't have time to read the entire study and they want to get the gist of it, or they want to hear kind of straight from the researcher's point of view. So we're going to just ask you some questions about that. And also some more general questions. So we'll jump right into it. So your paper that I referenced at the beginning here, it introduces the term miseducation. How does this differ from, I think a lot of people are familiar with the term misinformation, in like the political and like social media space. So what's the difference between misinformation and miseducation?
Yeah, I think that's a great place to start, and it's definitely something that we spent a lot of time on in building out the paper. So happy to start here. So misinformation, we can think of it as something that describes the sort of spread of inaccurate or false information. And so when we were diving into the literature around misinformation, that's sort of the direction that we initially thought we were headed. But a lot like that spread of inaccurate or false information, well, it is sort of obviously an issue with the concussion materials that are out there. Like there is false information, there is inaccurate information, but it doesn't really deal with the reality that like it is the scientific community who is actively calling for more and more education as sort of this dominant mode of injury prevention. And this, when we were sort of building out our argument, has like that push from the scientific community. We think it has a really practical impact. So if we think about sort of where leagues, sport administrators, coaches, parents, etc., are talking about our response to the concussion issue, they sort of come under this understanding that we can sort of educate ourselves out of it. And that's the practical sort of piece or impact that we wanted to get at. And so to address that, we came up with the term miseducation as sort of focused on the outcome of an over-reliance on education as a mode of injury prevention. So what does that actually do in terms of concussion sort of conversations, in terms of other modes of prevention, and how athletes are sort of then responding to that education piece?
If that makes sense. Interesting. Anything to add on that, Kaleigh?
No, I think Braeden nails it. I think it's that distinction is really just about how much we now in the concussion space are relying on education to do most of the heavy lifting. So we rely on education to teach signs and symptoms. We rely on education so that athletes and parents know what to do when they have a concussion, et cetera, et cetera. And so our critique and our kind of call for action is kind of to push back against education as, this main source of injury prevention when it comes to concussion, and to start to think about other ways that we can address concussion and support injury prevention that doesn't require this sole focus on education.
Okay. definitely need to correct me if I'm wrong here. I'm trying to make this make sense for me and for the listeners. So let's try to think about examples here. So misinformation. Previously, I think all of us, at least when I was younger, would hear, "Hey, if you have a concussion, you need to stay in a dark room. You have to turn off all the lights. You're not allowed to sleep, and don't drink too much water." So that is like misinformation about concussion, and so we could correct that, and we could give athletes better information about how to manage symptoms for concussion. But that would be if we were over relying on that and expecting that to drive positive outcomes, and that would be like a miseducation. Does
Yeah,
that make sense?
totally. I think that's a great example. Like I distinctly remember my parents waking me up after I had suffered a concussion, like just to check, like do that like health
Right.
check and not let them sleep too long. That's certainly misinformation that is still like somewhat surprisingly still sort of circulated within concussion related care. And then exactly, so relying on only education as the mode of injury prevention. So how are we going about preventing concussions? And our dominant approach to date, like, and there are exceptions to this, but widespread approach is through education. So we're informing athletes of the symptoms, of the risks, et cetera, and we're sort of putting the responsibility on them to then report their injuries and respond in the appropriate way. And so that is then what we would characterize as miseducation, or that's what miseducation sort of allows us to analyze critically.
So miseducation is sort of like a understanding it from a practical perspective, like if it works or not.
Yeah, it's an analytical tool, I think, is the best way to describe it, to think critically about what are the impacts of our over reliance on education in terms of our progress on prevention and how athletes are actually responding to concussions.
I think we could, if it's helpful to think of it as when we rely on education, we're miseducating athletes into believing that if they have enough or a sufficient amount, as we say in the article, education, then that is going to be enough to help them, to prevent injury, to support their care, and so on. And what we're seeing is that that's just not the case. When athletes have enough information or enough education, it doesn't necessarily have an impact on their behavior or the decisions that they make around their concussion management. So this idea of miseducation is just kind of pointing to this idea that when we only focus on education as a way to teach athletes or teach the sport community about concussion, we're really doing a disservice with respect to how we should be approaching it, which is through other methods of prevention to support concussions.
Okay, so let's talk a little bit then about what you're seeing and kind of the approach you took. So your study was based on in-depth interviews with 28 youth athletes. I guess what was the most surprising thing that you were hearing kind of over and over, listening directly to the young people that you feel like you might not have gotten if you had approached this study in a different way?
Yeah, I mean, speaking with athletes directly, like taking a qualitative approach as we did, really just allows us to hear more about their experiences and capture nuances that we don't always get at with surveys. So when we ask athletes, about information sources, where do you get your concussion information, and what does that look like? We're able to sit down and kind of go back and forth over that question with participants, right? We can break it down, we can talk about it. And in those exchanges that they have through those dialogues, that's where we kind of uncover some of the richest information. For example, how athletes feel about scare tactics was something that came out that you might not be able to capture if you just ask athletes, where do you get your information from? And they say, I get it from my coach, I get it from a website, and so forth. But when you ask them, okay, well, what do you think of that information, or how do you use that information, or how does it make you feel? That's where we kind of get to enter into some of those really interesting territories where we hear how it's impacting their choices, their decision making, and it really allows us to take a rich analysis to the work.
Awesome. So next question here is one of the findings you noticed that athletes, I think you talked about this already a little bit, that they feel that they're sufficiently educated, so they know what a concussion is, they can list off what the symptoms that are related to it are and protocols, but you found that this doesn't lead to behavior change. So why does this gap between a knowledge of concussion and action persist? I guess, like, what is the behavior change that you're looking for, and why is there a gap there?
Yeah.
No, I'll stop there.
No, it's a good question. Yeah, so we know in research, research suggests that there is a gap between intentions and behavior, and this exists outside of concussion work. This is kind of at a broader
I think
theoretical.
that's pretty much the human condition, is it not? Like,
It is.
I want to be all these things, but I can't.
It is, but we still really rely on some of these tools and these lenses that say that if we know what someone intends to do, that is what they're actually going to do. And of course, Eric, like you said, when you speak to a person, they're like, yeah, like here's my New Year's resolution, and then here's what I'm actually doing. So there's a significant gap between your intentions and your behavior. So when we say that athletes are sufficiently educated, what we mean is that they have the knowledge on what they should do. Maybe that's about their intentions to report, but their actual behavior is quite different, meaning that their education isn't necessarily influencing their behavior change. And then that's not to say that the education isn't important. Like things like in Ontario with Rowan's Law, having mandated concussion legislation, all of that is so incredibly important. And it brings people up to kind of this baseline level of concussion knowledge that they need to have. They need to know what the signs and symptoms are. They need to know what the protocols are if they're injured. But what our argument is saying is that once you hit this level of sufficiently educated, it's not actually influencing the choices that you make around your concussion. And we think it's just because there's too many other factors that influence their behavior. So you might know what the symptoms of a head injury are, but what does your coach think about concussions, right? Is it a championship game? Are you the star player? Were you just injured a couple weeks ago and you are gunning to come back, kind of thing? So when we only rely on an athlete making a decision by giving them an information sheet or having them complete the same webinar series year after year, we think that they're really failing to capture some of the nuances that are part of sport, really, are part of sport culture, for better or for worse. And these factors ultimately influence their decision-making around concussion reporting and around concussion management.
Okay, interesting. One of the things that we saw in the study, or many of the athletes in the study, they noted that there were scare tactics being used, worst case scenarios. So you've highlighted that there are ethical and practical problems with this. Could you tell me a bit more about that? Is fear ever an appropriate tool for health education, or is it always going to ultimately backfire?
Yeah, I think that's a great question. And so firstly, it wasn't overly surprising to us that young people were sort of pointing to fear as a method that would potentially change behavior related to concussions in the most impactful way. If you think back to when you were a young person, like we sort of, and this is a bad analogy for a podcast about head injuries, but we've sort of beaten young folks over the head with fear or scare-based education tactics in health promotion, right? So if you think about communication or education related to smoking or drinking and driving, even with physical activity interventions, right? All of these things have historically relied on generating sort of fear amongst young people with the hope of discouraging or changing a particular behavior. And so with that as context, it sort of makes sense that young people or young athletes would be looking for that within their concussion education or the concussion materials. As you say, we definitely raise some ethical and practical challenges with this approach. If we think about the sort of state of young people in our world today, I think most people would agree that instilling a further sense of anxiety and fear in them would maybe not be the best approach. In our research, in our work, Kaleigh and I have both spoken with young athletes who are almost like paralyzed or debilitated by a fear of concussions, when in reality, we know that the vast majority of concussive injuries sort of resolve spontaneously within that 2 to 3 week period. But that sense of fear is deeply, deeply ingrained in them. And so what impact does that have beyond their experiences in sport and different things like that are some of the ethical considerations that I think we need to make. It is a balance, right? And that's sort of where we move towards centering the athlete's voice itself in as many ways as possible. So in concussion education materials, can athletes be sort of engaging with athletes so that there's that shared sense of understanding? Are good friend and colleague Nick Reed and his lab have also sort of pushed peer support as an intervention through concussion recovery, so that it's not us as researchers sort of engaging young athletes or even clinicians engaging young athletes through that recovery process, but they're able to sort of build on that shared experience rather than sort of this sense of anxiety and sort of overwhelming fear that can also play into that equation.
So ethical concerns aside, practically this kind of reminds me of, I might butcher this explanation, but the whole smoking thing, I remember listening on maybe some other podcast somewhere about the practicality of putting those big, smoking causes cancer and stuff like that on the cigarette packages. And I remember somebody explaining it like this, where, you're addicted to cigarettes, or you're stressed out. And so you go to buy cigarettes. Then you see on the pack of cigarettes, it says that smoking is going to, you're going to get blood in your urine, and you're going to have heart problems, and it's showing all the plaque on your lungs. Mm-hmm. And that stresses you out. It makes you anxious about the fact that you've just now bought this pack of cigarettes, which, because cigarettes are your coping mechanism, is going to probably cause you to smoke more cigarettes. And it's sort of, there's a good argument, I think, to make from that kind of just quick armchair logic story that's actually not going to be helpful. I think you could make a similar argument for, like, scare tactics talking about climate change. It's like, if you're scaring people constantly about climate change, you might actually make them more anxious and cause them to become more consumeristic, which would ultimately contribute even more to climate change. I'm trying to understand how this could impact concussion, and this is super conjecture tangent here, but, like, if you said people are paralyzed with the fear of concussion, like, what if that results in them not preparing properly for the game, not stretching properly, and then tearing their ACL or getting a concussion or something like that? Like, I don't know, it's super speculative, but is that kind of the logic?
Yeah, I think you could absolutely think about it that way. So what is their focus pregame and different things like that. I think you can also think about it, like, if we think about what sport and recreation does for young folks, for a lot of people, it is their release. It's like that they go and they can sort of shut off and just play and have fun and move their bodies and so on and so forth. But if we're filling that space with anxiety and fear around potential injury, then that's no longer that sort of helpful, healthy space for them. And so that is part of the reality for sure. The other aspect of it is, like you said in your smoking example, is health promotion literature. Like, we've known for a long time that scare and fear-based education is just not effective in changing behavior. And yet it's like the easiest, most sort of flashy thing. And so we continually rely on it. But places of anxiety and fear are not where behavior change comes from ultimately, and the literature is very clear on that. And so I think having that understanding and how we chat about athletes who are maybe looking for that because of what we've engaged them on in other topics is important.
Yeah. And I think, Eric, picking up on that analogy that you gave about smoking and how it's tied to their identity, we published some work last year that focused on how young athletes make decisions about whether or not to report concussions or not. Yep. And one of the key findings was that athletes weigh the risk of not playing against the risk of playing with a concussion. And for a lot of young people who identify so strongly with being an athlete, them not playing at all is a more frightening outlook than possibly playing with a concussion, and they make their choices accordingly. So I think it's really difficult to just extract the person from the sport environment and say, you need to make these decisions in isolation, because that's just not how we make decisions. And so therefore, it really shouldn't be how we educate people, right? We can't just say, here's how you do it, without any kind of context or insight into what their sport environment or their broader environments look like, and expect them to make decisions that align with our recommended guidelines for concussion care.
Yep. Yeah, for sure. So the next question here is around equity and access. So you highlight inequities where access to quality education and concussion prevention deepen existing inequalities in youth sports. You want to touch on that a little bit?
Yeah, for sure. So I think this over-reliance on education as the mode of sort of injury prevention, as we've been talking about for the last few minutes here, is one of the problems with it is it just totally ignores the fact that there are existing inequities and inequalities within our sports system. And so like we can look at that in access to education, access to treatment, or different facilities, or different clinicians like athletic therapists and different things like that. Those are things that there are not sort of equal access across different populations, different geographic locations, different schools, et cetera, et cetera. And so if we simply just sort of pump out materials and put them out into the universe and sort of assume that the rest takes care of itself, then we're missing like engaging those inequities in a meaningful way, identifying them, and then seeking to address them with like really intentional action. So in our research, we one of the really I think powerful examples was across the public and private school sector. So we spoke to athletes who went to a private school in the Greater Toronto area. Heard a lot about the sort of many resources that they had access to, the different education that they had taken as part of being an athlete at that school. Had like the resources in terms of team specific resources, both in practices and in game situations. And then we also talked to folks who were not in the private school system and in the public school system, and they just simply didn't have that access. And so in the example that we bring forward in the piece, I think the participant says, I just ended up not going to class. Rather than as a coping mechanism for dealing with their concussion symptoms. And so that's just a really practical example of thinking about how inequities can be furthered by just relying on education rather than being intentional in sort of seeking to understand like equitable access and different things like that. And obviously, we can think about that beyond just public school and private school, right? We can think about inequities in different populations related to gender, race, specific sport, and so on and so on.
Interesting. I guess that kind of stems from, I think, something you said earlier about looking at the athlete in isolation and kind of treating them all as like individuals and treating them all as if they're essentially the same. And I guess they're not, right? And so you have to take that broader context into context there. So, then when you move beyond the individual, right? So your research indicated there's an over-reliance on this education that's primarily, it seems sort of built to address an athlete in isolation, kind of removed from the sport, removed from the school, or removed from their socioeconomic situation that they're in. But what would it look like to genuinely shift more responsibility to the sports organizations and policymakers where you do have that broader context? And could you give me an example of a primary prevention strategy that would make a real difference there?
Yeah, I think what we'd like to see, and we are admittedly starting to see it, is more conversations around, like we would describe it as the systemic realities that sort of influence the concussion issues. So we can look at things like, in some sports, the glorification or celebration of violence, and as being sort of part and parcel to the fabric of the sport culture. So we can think of hockey in that regard, and if we want to bring our Canadian lens to it, so that has an influence on the concussion issue in more ways than one. It's a culture that people grow up in and become established in, and so they sort of reproduce that in their play and in their expectations of their peers' play, and so on. And so I think conversations around some of those realities in relation to policy, in relation to potential rule changes, depending on the sport, are examples of those more primary prevention strategies that will ultimately make a difference. Even things like reviewing supplemental discipline policies and those processes have a practical impact and are more upstream than just education. I think, as Kaleigh said in one of her earlier answers, that doesn't mean that we just don't educate athletes, right? And I think one of the things that we point to in the piece as well is that our education can actually engage beyond signs and symptoms and talk about some of those sort of sport or sport culture pieces in understanding why athletes would or wouldn't report, why they would behave a certain way in one situation and not in another. But that can't be our only answer. And so looking upstream to rule changes, to policy changes, how do we create the conditions for our education to have the most success, to be most impactful in sort of mitigating concussions within different sports settings is sort of the question that we're getting to.
Okay. Is there, you know, from the perspective, you know, you talked about infographics or like online modules being sort of like ineffective. You mentioned a couple ideas like safety huddles or co-creating materials with athletes. Could one of you elaborate on some promising alternatives that could improve the education or the engagement of the athletes and help to solve the problem?
Yeah. So when it comes to materials, we found that athletes in the study didn't always find certain types of materials to be engaging. And that doesn't mean that infographics and modules can't be helpful. They can certainly help address some of those gaps and kind of bring back up to baseline what we were talking about in terms of having that sufficient level of education. So they can be great for that as a tool. But when we refer to other materials like safety huddles or co-creating materials, what we're really getting at is bringing in athletes in order to take a more participatory approach to concussion prevention. So when athletes are engaged and have a say in what their sport culture looks like, that's when we might be able to start to see some meaningful change around behaviors and around concussion management. So rather than being, you know, kind of passive participants within this kind of broader concussion care landscape, we kind of give them some of the tools, give them some of the power to say, like, this is what is helpful to me, or these are the types of conversations that I think that we need to be having. Because when it comes out, and, you know, as Braeden kind of spoke to about, you know, these upstream prevention approaches, things like policy changes, things like rule changes, we can also be thinking of these at, you know, the interpersonal level, right? So if athletes are telling us that one of the reasons that they don't report their concussions is because their coach is going to be all over them if they miss the big game, or, you know, they know that their coach is going to bench them if they have to go out and do like a baseline assessment test, then that impacts their choices, right? So if we start to talk to the athletes and bring them in and have them help create materials and engage in different ways to prevent or to engage with concussion prevention, then we might start to see things that we've been previously overlooking that would actually be really helpful in kind of changing the landscape of what's happening currently.
Okay, thanks, Kaleigh. So you mentioned the coach, right? The administrators. Just in the interest of time, I'm going to jump to the last couple of questions here. So let's say there is a coach or a league administrator of some sort, executive that's listening here, and they want to do better. What's one concrete step that they could take next season to move their concussion education towards a more meaningful approach that you're describing?
Yeah, I love that question. I think for coaches, it's impactful to remind athletes that they have value and worth outside of their roles as an athlete. I think it's important to emphasize that they're not going to be rewarded for playing through injury, but also that they're not going to be punished for speaking out and saying that something is off. And for some coaches, this might seem obvious. Like, of course, I would never expect my athlete to play through injury. But we know that there are studies that indicate that that athletes report perceived pressure from coaches to play through injury. So it's happening. So I think that would be a great place to start with coaches, just to have those conversations about athletes as people, as opposed to athletes as commodities or athletes as, you know, scorers or whatever. And I think that could make a significant shift. Administrators as well. I think that changing the culture within their organizations is an important first step. And that could look like a safety audit where you start to reflect on what your expectations are around concussion management in your club or in your organization. And how do your expectations around concussion management align with the actions of the club? Like what the club is saying and what they're doing, is that what you're actually expecting from your athletes and your coaches? And maybe starting there would be a good place to go.
Yeah, I think, you know, the stance that the organization has on concussion, their policies, their protocols, and their actions, more importantly, they make a huge impact. Because, you know, I'm hearing you talk about, you know, athletes are reporting that their coaches are, they think their coaches are going to be all over them. Now that's definitely the case sometimes, but I bet you there are other cases where the athlete just thinks that's the case, but that's not actually the case. That the coach would be totally fine if
Yeah.
they took the rest of the game off to make sure they didn't have a concussion before they came back next week. So that just doesn't happen properly if the athlete is under a false impression of what the coach wants. So yeah, that's a really interesting insight there. The last thing here is the concept of miseducation that you brought up, potentially applying to other areas like doping or dangerous weight loss practices in sports. So how can this framework help us to critically examine, education as prevention models across sports and public health and more generally?
Yeah, I think we can think of it as in terms of education is really this kind of path of least resistance, right? We can always educate individuals to make better, more informed choices, regardless of the health outcome, right? It's an easy way to do it. It's really low hanging fruit in terms of addressing education. But when we kind of adopt this miseducation lens that we're calling for, what we can do is start to encourage the critique of that approach, critique that reliance on education, in that it's an individual's responsibility. And then in doing that, we can start to embrace and work towards more upstream interventions and strategies like Braeden mentioned. So kind of moving away from that and really addressing it at a broader level. I think is a good place to start. Braeden might have something to add on here. He loves this piece of it.
Yeah, I think, like I said, when we originally started talking about misinformation, and like we can throw disinformation in there too, right? So disinformation would be the intentional
Right.
sort of spread of information, misinformation, just inaccurate information, etc. But when we looked at the literature, there's like just the way that these terms are being used within public health is just inconsistent. There's not really solid definitions across the literature. And so what miseducation potentially allows us to do is to think critically about this reliance on education and its ultimate impact. So I think it'll help us build sort of more engaging, more useful, more impactful education initiatives, but then it also, as Kaleigh indicated, encourages us to look upstream at sort of what else we're doing to change that, the conditions in which those behaviors are taking place.
Yeah, it definitely seems like an interesting thing that you could talk all day about, right? Like, I mean, kids nowadays in school or in sport, if they're wondering about concussions, they're just gonna pop it into Chat GPT, right? And so what is the function of the education? What are you trying to steer them towards? Ultimately, it needs to be a practical outcome. That's super interesting. Is there anything, Kaleigh or Braeden, that you didn't get a chance to talk about yet that you wanted to mention before we hop off?
No, I think this was really great. I will say the paper is open access, so anyone can read it, and we can provide a link if you need it to the group. But yeah, we love chatting about this stuff. Like you said, we could talk about it all day. And I would probably say the takeaway is just for us all to kind of think in the ways that we can move beyond education and start thinking about how the sports system itself is something that we can hopefully address to make change and, to improve the health and safety of the athletes that participate here in sport in Canada.
Awesome. Yeah, we'll definitely pop the link to the study in the description of the YouTube video here and wherever else we do it. But yeah, anything else, Braeden, before we jump off?
No, I think that sums it up. Thanks so much for the opportunity. Really appreciated the opportunity to chat about it. And yeah, if anybody else is interested, just reach out, and we're happy to chat further.
Awesome. Well, thanks so much, Kaleigh and Braeden. And like I said, we'll pop the study into the description so you can take a look. And thanks for tuning in.